Assalamualaikum warahmatullahi wabarakatuh. Welcome to Roots of Drug Administration. Our objective today is to compare the advantage and disadvantage of ROA and how to apply it in clinical practice. For the synopsis of this lecture, you can read yourself. Okay. Please play the game after this lecture. Right? So the condition of everything is there. Okay. Route of administration can be divided into enteral, parenteral, and others. So for enteral, you have oral, sublingual, and buccal. For the parenteral, it will be intravenous, intramuscular, subcutaneous. For others, it can be inhalations, intraspinal, topical, transdermal, and others. Sublingual is where you put the tablets under the tongue, and this tablet will be absorbed through the systemic circulations. Therefore, you can bypass the first fast metabolism. Example of drug is GTN. Another route of administration is buccal, whereby you put the tablets between the cheeks and the gum. When we talk about oral administration, we talk about tablet, capsule, or syrups. Right? The advantage is very obvious. It's safe, convenient, and economical. So the disadvantage is it depends on the absorption rates. If the absorption rate is good, then you can give oral. If the absorption rate is small, then you should not give through oral administrations. Okay? And it's also it takes time. If you give oral, it's slow onset, right? And it also depends on the compliance of the patients. Parenteral drug administration. Intravenous is whereby you inject the drugs direct to the vein, right? So the advantage is very big. It is very valuable for emergency conditions, very fast effects. And you can predict because the viability is 100%. Okay, this is good for a drug which have high molecular weights, and normally we can also use for unconscious patient or uncooperative patients. So by giving intravenous, you can bypass the first pass metabolism. Intravenous have limitations. Sometimes you can cause overdosing because sometimes you inject too much of drugs, okay? Or it can cause sepsis if you are not careful, or you have difficulty to find the vein, right? Intravenous is very useful if the drug that you are going to give is very irritant. So you cannot give through intramuscular or subcutaneous. You need to give through intravenous. All right. Now we are going to talk about intramuscular injection. Intramuscular injection is where you inject the drugs straight to the muscles. Right. So there are two types. One is the aqueous solution, where after injection, the drug will be absorbed from the local blood supply to the systemic circulations. The second one is the specialized depot preparation. It will be absorbed slowly to the local blood supply. Right? And example of it is depot contraceptive. Right? Okay. So advantage of intramuscular injection is you can have similar fast response, okay, and it's also suitable for moderate volume of drugs, okay, but it's not suitable for irritating substance. Okay, the injection site is either at the buttock or deltoid. All right, so it also can interfere with a certain diagnostic that the site of injection of intramuscular is either at the deltoid muscle or at the gluteus muscle, upper outer quadrants. Another one is subcutaneous injections. The factor involved is similar with intramuscular injections, right? And it's only suitable for very small amount of drugs, okay? And it's not suitable for drugs which is very irritant, right? Example of drug given through subcutaneous is the famous insulin. This diagram is to show you the site of injection for subcutaneous injections, right? Normally, patient can do it by themselves. This diagram is to show you the angle of how to inject intramuscular, subcutaneous, or intravenous. This diagram is to show you the difference between intramuscular, intravenous, or subcutaneous. Now we are going to discuss about other routes of drug administration. Inhalation. Drug which is volatile can be given using this method. Alright. Our lung can serve as route of administration and also as route of elimination. Okay, so our lung has a very large surface area. Therefore, if we give drugs through inhalation, we can expect that we can have rapid absorptions to the systemic circulations. Example of drug given through inhalation is anti-asthma drug or anesthetic agents. Intraspinal. So normally this is used for spinal anesthetic. When we can have anesthetic agent injected straight into the spinal space, example L2, L3. So when we give that drugs, it can anesthetize the nerve below that area. Okay, so you can have anesthesia of lower half of your body. So this is useful for certain operation, for example appendix, hernia, hemorrhoid, and others. Intranasal. This commonly used by drug addicts. Okay, they use it to get the cocaine inside the systemic circulation. Transdermal. Some drugs are absorbed well via the skin, right? So the formation of the preparation of transdermal drug is normally in the form of patches, right? So we use it for non-irritant drugs only. Okay, example of drug is GTN. Topical. So one of the example of topical is the skin preparation. We use it to get the local effect on the skin, right? But we can have systemic effect if there is a lesion on the skin, right? For example, topical steroid. All right. For the eye drops, when we give the drugs, it can be absorbed through the epithelial or the conjunctiva cells, right? So normally for eye drop, there will be no systemic side effect. All right, it's just the local effects. Example of drug is doxorubicin, right? This is the reference. Okay. Thank you.